I'm Dr. N. Murugan. I'm a hepatologist, which is a liver specialist. I am based at Apollo Hospital in Chennai. So I am a specialist to look after patients with liver problems. So my topic in this forum is to talk on liver failure, because this is a very serious and an important problem, and it is more commonly seen in the last few years. There are two types of liver failure. One is a chronic liver failure and the other is acute liver failure. Chronic liver failure is generally associated with a condition called cirrhosis of the liver. This is a serious condition where the liver gets damaged beyond repair. It is a permanent damage due to many reasons. The liver becomes hard and nodular. The size may change. Usually it shrinks and becomes smaller and slowly loses its function.
My name is Teddy Godwin. I'm coming in Tanzania, East Africa. I've started to know my problem since last year, 2011, 2012. When I was going there to my hospital, they've told me that it's better if you are going to take the ultrasound. The first time when I have taken the ultrasound, it was July 2012, and that it was my first time to know that I have a problem of liver. So I have started to run with my specialist doctor from my referral hospital, Muhimbili in Tanzania. But after going for a long time, we didn't find anything. So my doctor has tried to advise me that it's better if you are going to find it to another hospital outside of the country. So the first one which we have started to know, it was this hospital, Apollo. Of course it was not Chennai, but we know that it's Apollo. So we have started to go Hyderabad. Hyderabad, we have stayed there for 2 months, but there was some problems because I think it was the first time they was starting to run with liver transplant, but they failed because there are some machines. There was some problem. So they have transferred me to come in Chennai. So I came in Chennai since 6th July this year. So I've started to wait there, and I was very, very good communication with the doctors. Even when I've stayed for 2 months, but I was expecting that I'm going to get something. Actually, when I was coming in this country, I was lost everything that I'm not sure if I'm going to go back, if I'm alive, because my condition, it was very bad. But I praise God, the passing of the doctors. 18th of August, we have gone for surgery. Of course, only 5 hours, which I didn't know what is going on. But after that, up to this time, I don't see any problem. And always doctors, they are coming to see me, to ask me if there is some problems. So I didn't see any problem. When I was ICU there, I've seen the communication of sisters. It was very, very, very good. If you have got some problems, you call even one, they can come even 2. So this, it was very, very happy to me. I was expecting that I'm going to get good things. Before that, when I was Hyderabad, is the first time to know that the liver is not good, so we are supposed to get another donor. So they have asked us if we can get if you can find any person, but we need the one who is a family, not out of their family. So my son, my first son, is the one who has complete everything to be equal. He was equal for everything. So we called, then he came from Hyderabad, then when they transferred to come to Chennai, we came all together in this one. But my son, who was a donor, he has gone there, but he was very, very fit. He has stayed for just, I think, 3 weeks. Now, even this time I was communicating with him. He told me that now I'm going to report in my duty. He's working with an insurance company. But myself, I'm retired since 2010. But my son is working another region. But ourselves, we are living in Dar es Salaam. Our donor, and it means our son, is another region. So today he has gone there to report his job. So actually he's fit. I don't say anything, but so some people who don't know the Apollo, I can advise them that it's better if they are going to start here, then they have to find it to another hospitals, because they have got something which I didn't expect. Even when I'm telling them at home, because they have seen me my condition, and if I'm talking and they have listened to my voice, they don't expect that. Is it Mr. Teddy? But I'm Mr. Teddy. So now I'm expecting to go back on Sunday this week. But I'm okay. And which I'm going, and I'm going to tell them, even my doctors from there, in my country, is the cooperation within the doctors. This is the one thing which I'm going to tell them, that I think we have to change something. Cooperation is a good thing which can help within a patient. Instead of doctor, only one you are going to attend the patient every day. If you are not around, then the patient is going home. That is in our country. If your doctor is not there, so you can wait even 2 weeks. So, you know, the disease is not going to wait, it's going to increase. That is a summary which I can say for which I have seen in this hospital. Even food, actually, we don't have any problem. The problem maybe is just minor. I can say that is a minor. You know, in this country, they are using so much chili. In our country, we don't use the chili. So the problem which we was facing first time is only chili. But food, it was very excellent. After my donor has gone at home, actually I have seen most of the family. They see that is something which is not impossible. But it was impossible to my son. He was a donor, and what he has done, it was very difficult to believe that he is going back or not. But I can advise another family that if there is some problems to another one of our family, it's better to believe, to donate to your brother or to your sister. There is no problem, because I have seen my son. He has donated to me, but he don't have any problem now. He has stayed just for 3 weeks. Now he has already reported to his job. So another family, they have to, I think they are not supposed to be afraid. There is no problem which I have seen in this hospital. I'm not talking about another hospital different of this Apollo. I'm talking about Apollo because I know the communication, the cooperation, and what they are doing. So if there is some of the family, one of the family has a problem of liver, don't be afraid to donate. There is no problem. This is I'm saying because I have seen my son. He has donated to me, and now he's fit physically, because he has already started with his job, and no problem. Even myself, he has donated to me, but I don't have any problem. Now I'm just waiting to the doctors to check me. Then now they have already promised that I'm supposed to go in my country. That's all.